Joining me now is Stefanie Pawluk. She is the Northwest Arkansas Council's Executive Director for Healthcare Transformation. Did I get that right, Stefanie?
You did. Thank you.
Thank you so much for being here and appreciate you. Congratulations on the new job. And
Thank you.
tell me a little bit for people that don't know you already, just a little bit of your background and how you found your way to this position.
Sure. So thank you so much for having me, Roby. Honored to be part of this group at the Northwest Arkansas Council. Prior to joining this role that I just started last week, I was at the Heartland Whole Health Institute, which is Alice Walton's healthcare initiative. Out of that, also connected to it is the Alice Walton School of Medicine, which I know you're aware of. So there's a lot happening in Northwest Arkansas in terms of healthcare. And moving to this role, I'm excited to really work with a lot of the providers and partners in the community to think about how we move healthcare forward and make this a true healthcare destination for the region and the state. Before even going to Heartland Whole Health Institute, though, I have to say I moved from upstate New York. I would have a background in health policy, master's in public health, and have worked on all different kinds of healthcare initiatives for provider organizations at a hospital association where I was in the middle of different disputes and innovative partnerships between payers and providers. So kind of in the front line of that work, which I know is getting a lot of attention lately. And also was at our state health department thinking about ways to advance primary care and think of new innovative payment models at the state level and across an entire region. So really excited to kind of have those tools in my pocket as we think about healthcare in Northwest Arkansas.
Well, it sounds like you're barely qualified for this position. I know you're going to have a lot on your plate. One of the great things about stepping into this new role for you is that there has actually been a lot of research that's being done in Northwest Arkansas, as well as for the state as a whole. And the council itself has put together a kind of a report, a plan. You've had a hand in shaping some of that, this 2030 report that's out
Yes.
there. Give me a little bit of an idea of what you feel like the main areas will be that you'll be focusing on in this new role.
Sure. So that report kind of highlighted a lot of the success that the region is having in healthcare. And since its last report prior to the pandemic, which actually did establish the division itself, and that division was established at a perfect time because of the pandemic. That group was able to come together and do sort of resource planning and think through, PPE issues and vaccine distribution, all those kinds of things during the height of the pandemic. The division kind of was set up to do that work. And the first report kind of laid out, we have this outmigration issue, people leaving the region for certain specialty care services. So this report kind of did an update on that and said that we're doing better in a lot of those areas, but there's still work to be done. One of the areas that it calls out is kind of thinking about how we pay for and deliver healthcare services. So we talk about value-based payment, value-based care delivery, and kind of getting away from the fee-for-service model where we're kind of just paying for services and not outcomes. And, healthcare costs are very high, financial strain on individuals, on the health systems, on the providers. So kind of thinking about different ways that we can bend that cost curve and really work on helping to have people be well. So the value-based care piece will be one major component that came out of this most recent report that I think we'll be working on from this new role at the council. And we can't also forget about workforce. We have a lot of retiring healthcare providers all across different levels of the care continuum. So we have to think about what roles we need, what roles we need to backfill, and then how do we get students interested in healthcare again, coming out of pandemic and different strains on the healthcare system to make sure that we're filling those roles that we're going to need in the future. And then when you think about other peer markets that were highlighted in that report, one of the areas that we need is also to think about how we can come together in the healthcare space to focus on research and just kind of, if you want to be like a research triangle, what are sort of the things that we need as a region to kind of get that elevated? And all those things will help with, recruiting providers to the area and provider retention and kind of helping the healthcare sector grow as a whole.
We have a legislative session coming up where policy will actually get to be set. I know there's a lot of things on everybody's plate, and there's a lot of different diverse opinions about where we should go with some things. I know reimbursement rates will be something that's pretty critically looked at. I know medical school placements, the residency slots is another area where there's going to be a lot of attention. Tell me what you might be focused on in this legislative session that are some things that would mostly move the needle in the right direction under from your point of view.
Sure. I think it's going to be all of those things that you mentioned. I think that, the state is thinking about Medicaid and the cost of care in Medicaid. So that's something that I think will be plugged into and kind of following closely what they'll be looking at. And also from the purview in this role, kind of working with the leaders of the health systems to see, what are they dealing with on the ground level and how can we share that message with policymakers. So.
I think one of the things that's been a little bit lost in this too is, and I'm going to get pretty wonky with you and with our viewers and listeners here, is this the way Medicaid works is there's the feds pay a certain percentage, they match a state rate. It used to be about 3 to 1, 75% federal, 25% state. That number has come down as personal incomes in Arkansas have risen, and for every 1 percentage point that we go from federal to state, the state has to pick up about $63 million for every percentage point. So as it comes down off that 75% to closer to 70, substantial sum of money, which is why the state is paying more. I kind of want to spell that out and kind of get your take on that's not a bad thing because incomes are rising, but it is a bad thing in that it puts more burden on the states. Am I right in interpreting all that?
Yeah, it definitely puts more burden on the state, and kind of how that cost shift works from the federal to the state side. We do need to think about how healthcare is financed as a whole in the state. So if we look collectively at our Medicaid population, what's our commercial population, our Medicaid expansion population, there's waivers that the state has. So we need to really kind of look at that whole picture and kind of think about what our state looks like and sort of the different regions and the different needs and how reimbursement underpins all of these things to kind of make sure that we're making the right long-term plans for our state when we're thinking about how we're delivering care across the state.